Right, so the first thing that we have to do is to install the ChatGPT app on your device. So first go to the App Store. Okay, you can search ChatGPT. So be aware that there are a lot of apps that mimic the original ChatGPT. So the one that we want is this one. The one which has a white icon with a black outline, and it says the official app by OpenAI. Okay, so the middle one. So as I've installed on my phone, then it just says open, so I can directly open the app. Okay, so if you see in your home screen, the icon should look like this. Okay. Okay, next we're going to learn how to access the app. Okay, so simple enough, just open the app. So once you open the app, you're going to be brought to the main page, or the vanilla version. This is a general version that everyone uses, everyone all over the world uses. So I don't want you to be using this one, because if you start using the general version of the ChatGPT, the answers that it gives you is going to be derived from all over the world. And the resources that the ChatGPT use is not going to be verified. So that's not what I want you to do. What I want you to do instead is to use the link that I've given you, so that you will be brought to the specific chatbot that I have created, which is called the Surgery Study Buddy ChatGPT. Once you have added that into your app, then you can see on the top left-hand corner here, you can click on it, and you can see that the Surgery Study Buddy chatbot is there. Okay? So here you are in the Surgery Study Buddy chatbot. Okay, the first purpose of this chatbot that I've intended for your use is for you to use it as a study aid. Okay, so because I've asked the bot to reference only your textbooks, you can ask it a lot of questions, any question that you have relating to surgery. So now we're going to learn how to write prompts. Okay, you can see the text box there. So the first key step that you have to perform is to introduce yourself, because the AI needs to know who you are, so that it can tailor the answer accordingly. So just say that I am a year 3 medical student. Okay, and then you can begin asking your question. So let's say you want to ask about what are the causes of hematuria. Okay, list the causes, signs and symptoms, and give references. Okay, so we give you the answers based on the textbooks that I've asked the bot to refer to. Okay, okay, so for instance, you can see the answer is being divided according to the organ. So kidneys, ureters, bladder, so on and so forth. Okay. Now you can also tell the ChatGPT whether it's doing something right or wrong. For instance, this is not what you have in mind. Okay. You don't want to classify hematuria based on the organs involved. Let's say you want to tell him that group the causes into painless and painful hematuria, not by the organs. Okay, so this is AI, this is artificial intelligence. So you have to teach him, because you are the real intelligence, you have to teach him what you want. How can it help you? Okay, so you have to teach it. Okay, so it gives off the answer based on what you want. Okay, so I would encourage you to keep on experimenting using this bot and see what it comes up with. Okay, bear in mind, however, since most of you will be using the free version, there is a limited number of prompts that you can type at a given day, after which it needs to be refreshed. Yeah, for instance, okay, you've reached your limit. Okay, so you have to upgrade to ChatGPT Plus. So this is one of the limitations. Okay, but you can try again tomorrow, or in this case, this afternoon. Next, we're going to learn how to use the ChatGPT to help you in taking history, either from real patient or during your role play session with your friends. So as always, type the prompt. So say, I am a year 3 medical student. Transcribe this patient encounter. Grade my history taking and give feedback. Additionally, you can also add another prompt, which is to tell the GPT that you're doing a role play. I'm doing a role play on history taking. Okay. Then you press enter. Okay, next you click on this microphone icon, which is within the message box, and then you can start taking history from the patient or start your role play with your friend, which is within the message box, using normal conversational tone. Okay, so we're going to give it a try. It's just a short 1 minute conversation just to demonstrate. Assalamualaikum Puan.
Salam.
Puan nama apa?
Nama saya Nurul.
Puan Nurul, boleh saya tahu datang hari ni masalah apa?
Oh, saya sakit dekat perut.
Oh, kat bahagian mana tu
Bahagian bawah belah kanan.
Oh, bawah belah kanan. Puan ada makan luar tak sebelum ni?
Tak ada pula.
Oh, okey. Selain pada tu, Puan ada demam tak?
Demam ada 3 hari sudah.
Muntah-muntah?
Muntah-muntah pun ada.
Buang yang besar okey ke Puan?
Buang yang besar okey.
Okeylah, saya rasa takat tu je lah saya nak ambil sejarah daripada Puan. Terima kasih. And then you press enter. And then the GPT is going to transcribe the conversation for you. So I purposely made a short history which is not complete. This is just a 40-second history. You're supposed to take a full history that as you have learned. So if you see here, it gives me a borderline score because I haven't managed to complete my history. So this is how you use ChatGPT to assess your history taking skill. It will also give you feedback on your strengths and weaknesses as well as areas for improvements. So again, you can try this with your friends as well as real patients. Just use normal conversational tone. Next, we're going to learn how to ask the GPT to assess our physical examination. Obviously, it cannot observe you performing your examination on the patient, but what you have to do is to narrate your findings, do a running commentary, or present your examination findings to the GPT. So again, the prompt here, you just say that I am performing a physical examination. Rate my examination and give feedback. You can also give an additional prompt. Do not assess other domains apart from physical examination. Okay, again, use the same approach. That is to click on the microphone icon and then start narrating your physical findings. So we're going to give you an example. On examination, this is a young lady who appears comfortable. She's pink and not dehydrated. She does not seem to be septic looking. The abdomen is soft and there is a tenderness at the right leg fossa with positive rebound tenderness and guarding. The Rousing sign is negative and the rest of the abdominal findings are normal. There are no organomegaly and there is no ascites. Again, press enter. So you just wait for the feedback from the GPT. Again, it is going to give you feedback on the things that you've mentioned and the things that you've missed. So again, if you notice just now, I missed a lot of things. Okay, so it gives you only a score of 5/10. Okay, so this is how you use the GPT again to assess your physical findings. So you have to narrate your findings. We're going to do a similar thing for the next step, which is formulating diagnosis. Okay, again, the same principle applies. It cannot see you, but it can hear you. So you have to give your list of differential diagnoses, points for and points against. So again, press on the microphone icon. So my differential diagnosis for this patient, the first one is acute pyelonephritis. Points for because she's a young lady. Points against because there is no urinary symptoms. My second diagnosis is acute diverticulitis. Points for is because the pain is at the right iliac fossa. And points against is because she has no constipation. My last and final differential diagnosis is acute appendicitis. Points for because it is a right iliac fossa pain in a young lady. Points against is because she has no fever. So as you can see, obviously the highest likelihood will be acute appendicitis. So when I put acute pyelonephritis as the first one, it says there's crack points, there are not so strong points. So overall assessment is possible, but doesn't give me a full marks. Okay, so for acute appendicitis, the score is over 5/5. So again, this is where you can obtain your feedback on your own using the GPT without having to rely on lecturers. It is more or less reliable. So the similar method is used when you want the GPT to assess your investigations as well as your management. So type, now I will outline my investigations and management. Rate me on these two domains and give feedback. And then as you know by now, click on the microphone and start speaking to the GPT. So for investigation, I'm going to send a liver function test for this patient to look for serum albumin. I'm going to send a coagulation profile to look for bleeding tendencies. And probably I will send a full blood count to look at the white cell and hemoglobin. I will do an abdominal x-ray to diagnose acute appendicitis. And for management, I think this patient requires antibiotics. So as you can see, I purposely didn't give it a perfect answer because I want to show you that the GPT is supposed to give you feedback on things that you can see the LFT is not relevant, okay, on things that are not relevant. Coagulation profile is unnecessary in this context. So full blood count is relevant. So this is a way for you to gain feedback. Abdominal X-ray is not the best choice in acute appendicitis. So not only you can use this as a feedback, you can also use this as a study tool because you know when your answer is wrong and why is it wrong and why you are not being scored, you're not given a high score for that particular answer. Okay, feedback on management, antibiotics is correct. However, further considerations such as surgical referral is not mentioned, which is critical. Okay, so overall it gives me only 4 out of 10, which is a fail. So if you answered in such manner in the exam, again, most likely you're going to not pass the examination. So these are the two main functions that I want you to use the GPT for. First, as a study tool to search for information and for answers. And second, to help you in your own activities in terms of history taking, physical examination, formulating diagnosis, coming up with investigations as well as management for the patient. So you can use this to check yourself as well as your friend. I would advise you to divide your answers in parts, history followed by examination, so on and so forth, because it's better for the GPT to analyze shorter scripts instead of a long 10-minute audio voice recording. Okay, so give it a try and inform me if you encounter any difficulties. Good luck.